Well, good afternoon, everyone.
Good afternoon.
My name is Josh Marshall, and I'm from the state of Indiana. I currently work in the Indiana Office of Technology, and I'm just here to share with you what Indiana is currently doing to help take our state and have government move at the speed of business. We formed the Management Performance Hub about a year ago based on the governor's ideas. And I'm just going to share that with you, and hopefully you find it interesting. So just as a quick agenda, just kind of briefly talk to you about how we were formed and our vision, the beginning of the MPH, and then these other things are different aspects of the MPH that we've been working on. So the MPH program was thought up one day when Governor Pence took office. He was having lunch with the OMB director, and the governor was like, how cool would it be if I could manage state government on my iPad? And at the time, Indiana wasn't exactly on the forefront of technology, and we just kind of laughed at him and said, yeah, good luck. So with that, we began the long, hard road of putting together what that would actually look like. So we came up with our vision and mission statement. So our vision is that Indiana will have the most effective, efficient, and transparent state government in the country, which recently we were rated #1 in our transparency website, providing budget information, spending, different categories. And then our mission is to develop an industry-leading, comprehensive, enterprise-wide data-driven management system. So that's what we have set out to do. Our OMB director, this is his favorite slide. He actually insisted this be in here. So Indiana, we currently have a $30 billion budget, which is probably small to California, but for us it's pretty large. And with that, we do fairly well managing our money, but we also have lots of data. 1 billion megabytes, which is actually a petabyte, of information that we don't manage very well. So what we wanted to do is manage our information like we manage our money. So through our planning process and our strategic meetings, we decided on this decision cycle, which represents pretty good what we do. We have in the OMB office a group of analysts whose job is to look at government efficiencies. They're supposed to look at agency programs, see what programs are working, what isn't, what are we spending our money on, the performance of the agencies, how well are they performing with their statutory obligations. And so as they're analyzing, they're making decisions, and when they go to make a decision, they realize, well, I can make a better decision if I had this information or if I had that information. So then my group would go, we'd gather the information from the agencies, we'd store it in our new environment, and then they would start over. They'd analyze it, and then they'd come back and say, well, we still need this or we still need that. And so it's just a continuous cycle. So that's been our model ever since. The most important thing to the MPH is the governor's support. About a year ago in March, the governor issued his executive order outlining to all the agency heads how important it was that they participate and cooperate with us. Ever since the governor has issued this executive order, we've removed quite a few roadblocks from the agencies. Basically in Indiana, we've got 96 agencies, and they've all acted individually. It's like 96 companies trying to work together. They don't share information, they don't have the same systems, they don't have the same processes, they don't have the same anything, except for they all are in Indiana. And so with this, we said, okay, we're going to fix that. We are going to start collaborating between agencies. We're going to start looking at each other's information and helping each other and be more efficient than we already are and save money and reduce government regulations. So with that, our executive sponsorship, it all starts with the governor, and then the OMB director, who's essentially a CFO who controls the money for the state, and then IoT, which was created as an enterprise agency to manage the IT infrastructure for the state. So my boss, the CIO, and then me as the IoT director for the MPH. So for IoT and the MPH, the team structure, we went through a couple of cycles to get to where we are today. We had some learning curves, some challenges, but we formalized our structure, I would say, at the end of last year. Basically, we have a steering committee, which is made up of a few key people. We got the OMB director, CIO, and then a couple other people from each OMB and IoT. With that, all they do is provide some direction, visions. They pick what case studies to work on, and then they're there for approving spending. Underneath there, we've got what we're calling operational technology and dashboard team and infrastructure team. So those are my teams. I'm currently the director of those. Basically, my infrastructure team is made up of system admin, some system architects, database admins, which basically control the environment. They do all the system access, security. They provide maintenance for the environment. And then my operational technology team, which we've put together to start looking at what areas we can improve operational technologies, improve operations within each agency. And so I have a team of a project manager, a couple BAs, some ETL developers, and some application designers. And the whole point of the operations technology is to take current state functions that are done in Excel or they're manual or they're done in Access and help develop enterprise tools that will make it easier, automate it, really just reduce some of the manual labor that we've been doing for years. So when MPH we first started, we had really 4 areas, 4 goals that we wanted to complete. Our key performance indicators, which is basically how we monitor agency performance. Use cases, and our first use case was infant mortality. Indiana ranks 46th as one of the highest infant deaths with under a year. We also wanted to redo our website. It just needed a little modern feel to it. And then a physical location, which was probably our favorite project because we built a little tech center in the basement of the State House. So if we talk about KPIs for a minute, the way Indiana was doing it, basically the agencies would keep track of their KPIs, and then every quarter they would come to the OMB director, have a big meeting, and they would do a show and tell and say, hey, OMB director, we have hit our KPIs. We're 90% across the board. Yay us. And then they would sit down. And then they go through all cabinet agencies, and then they wait till the next quarter. Well, it doesn't give OMB any information. It doesn't tell them, okay, that's great, you got 90%, but what does that really mean? How does that affect your performance? So what we did is we went through, and instead of agency self-reporting, we automated all the KPIs and added detailed information. So now, when the agencies come to their quarterly meetings, it's, okay, agency, you got 90%, here's the calculation. Now let's talk about how we improve this performance instead of just hearing how you did. And so that was actually a really big deal because it required agencies to share their information with us, to give us access to their systems and allow us to calculate it for them instead of they calculating it and giving it to us. This is one of our templates that we use for the drill downs. So before, at the top line, you see severe crashes on state-controlled roads. They'd say, okay, OMB, we had 1,500 crashes, and they'd sit down. Now we can say, okay, out of those 1,500, where were they? What county were they in? What city? What was the road class? What was the weather? What was the primary factor? Were they left to center? Why were they left to center? Was it drunk driving? So now we can look at specific crashes, and we can identify intersections, or we can identify what roads need improved. Do we need stoplights, stop signs, guardrails, Do we need to do a drunk driving campaign? Do we need to do a collect it or ticket for your seatbelt? You know, we can better form policy now because we know, what is driving those crashes. So once we had all this information, now we needed to display it. So one thing that we've done, we've partnered with SAP and some of their new dashboarding tools, Lumira and their HANA environments. This is an example of an old dashboard that was in our Oracle, and all it tells you is, a number of crashes, and then the green and yellow lines are targets. They need to be under, and that's all you saw. So now, with our new dashboards for KPIs, you can see we've got a couple different graphs that you can look at. You can look by county, you can map it, you can look at different road types, you can filter by county, you can filter by primary factors. So now you have a lot more information that you can analyze to help drive agency performance, public policy, and increasing the safety of Hoosiers. Also with the dashboards, changing outcomes. This is a map of drug use in Indiana, and we had the history to show. If this was a live demo, I could push play, and it could show you how drugs from the last 20 years, how they've expanded or reduced. This is a graph of heroin, which actually for some reason has grown in Indiana. And you can see when you play it, these bubbles keep getting bigger and bigger and bigger, which obviously for the state police is an issue. So they've actually, this is one of their favorite dashboards, because now they're forming some policy and campaigns to help reduce drug use. We're also using these dashboards for internal management, for the Office of Management and Budget and for the Governor's Office. The top left graph there is a pretty cool word cloud, which shows the number of employees by agency and if the number has increased or decreased. You can see Department of Correction has the most employees in the state of Indiana, but they have reduced in size as well. And then you see Department of Child Services, which has grown quite a bit actually. So, employment is a big conversation in Indiana. They want to know how many state employees do you have, and what are you doing to reduce state employees to save cost. So now we can show with a couple different head count dashboards the trend, how many, when, the average salaries, so we can better manage our human resources. So the next thing that I want to talk about for a minute is infant mortality. It was our first case study. This is very, very important for Indiana because we don't want to be 46th in anything, especially in infant deaths under a year old. This topic is pretty much the #1 agenda for everybody in Indiana, from the Speaker of the House to the Governor to the Senate side. Everybody wants to know, how can we reduce this number? Indiana has 7.7 deaths per 1,000 births, which is pretty high for the country. What's also a little discouraging is that while we're high, we haven't improved, while other states around us have been able to make up some ground on this. You can see by that map, of the middle map there, that Indiana is not doing so well. So what we did, with SAP's help, we took information from 7 agencies, and pretty much some examples of Department of Corrections, Revenue, the Health Department, Education. And so we took that information, we put it into HANA, which is about 5 billion rows of data, and we started putting advanced algorithms to it, some data science. We used R and Python and some different predictive analytics tools. And we went through to find out what are the causes of infant mortality and how we can improve on that number. So during the process, before we just had 7.7 out of 1,000. We could do it by, time and county. Afterwards, when we started applying some data science, we could find, there's two subpopulations to infant mortality. There's women between 15 and 22, and then there's 24 to 32. And so now we see that there's not just one bell curve, there's actually two. So now as we look at policy, we can get a little more defined on programs that we offer. The one good thing about SAP, though, is that HANA has allowed us to work a lot faster. With SQL, a 10-minute query would only run in less than a second in HANA. We were able to compress up to 90% of the information. So instead of having 500 gigs of information, it's now less than 10. So our storage is a lot cheaper. And then it integrates really nicely with R and Python. So this is a little timeline that we had for the infant mortality, and I'm glad to announce that yesterday we actually publicly released our results of the infant mortality. What we found, kind of three major points, is one major factor is inadequate prenatal care. If you go to the doctor less than 10 times while you're pregnant, you're at high risk for a child death within 1 year. And with that high risk group, most of them are on Medicaid, and most of them are under 20 years old. So now we can really define a good program that helps address this issue. And the First Lady and the Speaker of the House and the Health Department just announced a new program that will address some of those issues: access, transportation, how to eliminate copays for low income. What we found is the high risk pool is about 1.6% of the births in Indiana, but out of that 1.6, they account for 50% of the infant mortality rate. So through our data science and our new collaborative environment, we're able to really form a good policy on how we can affect change. On to transparency. On the left is our old website and Oracle's OBIEE. If you're in Google, you can't even see the graph. What we did is we created a new website with a little more modern feel to it, responsive design. You can look at it on any device. And we provided some new metrics. You can download the data, you can create your own graphs, you can bookmark things. It just gives it a lot cleaner feel, and just adds to our pledge to be transparent. This is our new technology center, which we built in the basement of our State House. Before, this was just a dark dungeon of offices and cubes. Now it's a very inviting, collaborative space. The Lilly Endowment provided money for the technology. You can see our governor standing in front of the screens. Those are touch screens. You can write on them and do all kinds of fun things. All the monitors at the mobile stations are touch screen. The desks go up and down if you want to stand or sit. All our meetings are there now. In the center there, our OME director, it's what we call our tech center. It's one of our meetings that we hold weekly there. And then our conference room and our enclaves if you need private time or you have a private meeting that you want to go to. And we went around quite a few different private companies and looked at their work environments. Eli Lilly, SAP in Palo Alto, Microsoft, GE, and everybody has been going to this open concept. So now we figured, well, if they're doing it, it's probably a good thing, we should do it too. And it's turned out it's the favorite room in all state government. Everybody wants to be in there. And it was also at no cost to taxpayers. We had a lease at a private building for OMB, and that we were able to get rid of when we moved everybody into this room. So with the Lilly Endowment and getting out of a lease, we were able to build this room at no cost. So some of our upcoming and future things that we want to look at, we're continually building dashboards for the agency heads that deal with specific issues. Some of our upcoming case studies, we want to look at recidivism, which we actually started a few weeks ago. We want to look at fraud. We're looking at technical education to help with the economy. We're also looking at some criminal public safety and crime watches. We're putting together a collaboration with city government as well to look at crime rates, how we reduce certain areas, trouble areas. And so we've got a lot of things on our plate. One thing that I want to mention, two key pieces of information about this whole project is, one, the legal aspect of it, and then the other part is security. So when we were working on the infant mortality project, dealing with child services and the health department, HIPAA and child service laws from the federal government are very strict, and if we didn't cooperate, we would all be in jail right now. So we have put together a governance document with an outside law firm that helped us put together a really sound memorandum of understanding that allows us to use the information to do further analysis and case studies, but still fall within federal regulations and guidelines. We should have it wrapped up at the end of this month. It's taken us quite a while. Actually, there's a lot of federal law that interferes, but we've worked through quite a bit of it. And with the security aspect, we've put together a very secure environment. So all the information that we get from the agencies, which includes sensitive information for matching, social security number, address, name, a whole bunch of fun stuff. Basically, you put in this room where there's no internet access, it's pretty much a clean room. You picture everybody in little white non-static suits and you have to pretty much know electronics. That's how it is. There's cameras, there's no access, everything will be hashed. You won't be able to read it, but you'll be able to use it for matching between agencies. So we've put a huge emphasis on security as well. And with the security and the legal and the positive policy development that's come from a lot of this, we've been able to gain the trust of the agencies. They've been more willing now than they were in the beginning to work with us. We've showed them the dashboards. They get very excited. So now they keep asking us, where's my dashboard? Can we add this information? Why didn't we give that to you? Well, you didn't want to. So now they're like, well, here's the information. So now they're much more willing to participate. So that's just a little bit of what Indiana is trying to do. We've been working on this for about a year. We've come a long way. It's still a long way to go. We're very excited about the things to come. Does anybody have any questions or anything they want to know? Yeah.
How many people are employed in the office, and then what skill sets do staff have? Are they all a similar skill set, or are you employing a variety?
So for me, I've got about 15 people. 3 of them are full-time and the rest are contractors. I've got a full-time project manager, a system admin, and what we're calling a chief data steward, who's in charge of the security, the infrastructure, access, Active Directory things. Everybody else, I've contracted out some business analysts and a web designer. We pretty much didn't have the skill set in-house to do a lot of this. The IoT's function is pretty much email and data center. So there's not a lot of development type skills right now. So we had to outsource it. Yeah.
So 2 questions. Just a sense of overall cost to kind of get this up off the ground and maintain it on a go-forward basis. And then the other part is, I would think different agencies can benefit from getting kind of real-time feedback from this and make improvements, you know, as they go, as opposed to, you know, I'm gonna sit you down and tell you how you're doing and how you're not. How do you manage those two?
Yeah. So as far as cost goes, you know, that's been the #1 factor in how much we can do, how fast. In 2 years, we're pushing $10 million. When in comparison, GE is spending about $1 billion on theirs. We've been very cost conscious. I know, you know, SAP is not always very cheap, but we've been able to work with them and get what we needed. I know we're using their information steward, data services, their Lumira, HANA, as far as our technology package. And with IoT and our cost structure, we actually have a tech fund when we build back agencies for purposes of reinvesting in technology. So that's where the initial money came from. And in this year, we actually have a budget line in the proposed budget from the governor's office for the MPH. As far as the real time, the agencies are now starting to see how important that is because before it's pretty much 6 months to a year lag in information. And so when you're trying to develop policy for the now, looking at information from way in the past, you know, you're kind of shooting yourself in the foot. So what we've been trying to show to the agencies is, look, if we can get your information near real time, and we can show you on a dashboard daily, you know, how you're trending, you can make decisions a lot faster that have a larger and quicker impact, especially on like recidivism or, you know, crime watches or you know, education. I know one of our next, after recidivism, we're going to look at fraud with the Department of Revenue and how we can combat some of that. So they are starting to see the importance of information having it a lot sooner than later. So, anybody else have any other questions?
Very impressive.
Thank you. Yeah.
A few questions. I'm curious, how are you capturing all data definitions, ensuring that same methodologies are being used when rerunning? So there's that, and then I have a subsequent question after.
Okay. Yeah, so for metadata and matching and data quality, there's a lot of work to be done on data quality. With our infant mortality project, we found that with local government, pretty much all the zip codes are wrong. So we've done a lot of cleanup. Our environment is a little different. So we bring all the information in from each agency, and we kind of store it centrally. And what we're doing with Information Steward and some other custom algorithms is cleaning the data as it comes in. We tag it with some metadata where it came from. And we're developing ETL packages that will it will clean it as it comes in, and then we can match it with some custom matching algorithms once it's in our system. And that's right now how we're keeping track of some data quality. We're still in the process of setting that up, but that's the plan. I mean, you know, garbage in, garbage out. So that's one of our first things for the environment.
And then is there any plan on establishing almost a decentralized view of this where you have data scientists within business units or evolving it so that the stewards of the data can actually make those decisions on their own?
Yep, so in our environment, we've actually broken it out to about 4 different HANA environments. So our first environment is the most secure. That's where everything comes in first. That's where we do the hashing and the matching and the cleaning. And then we have our dashboard HANA. Basically, that's where we're creating analytical views to be consumed by Lumira, and then you can do some data discovery on that. Our next environment is going to be probably more of a HANA cloud environment for our website, which will be you know, the least secure, as in there's no sensitive information on it. It's all for public consumption. And then we have a development environment. So we've kind of broken it out by levels of, who can have the information. So, anybody else? No? Okay.